All right, let's talk about something that can genuinely save a life. We're going to break down exactly what to do when someone is choking. My goal here is to help you turn that moment of absolute panic into a clear, confident plan of action. So let's get right into it. It's a scene we've all pictured. It's terrifying. Someone's hands go to their throat, that universal sign for, I can't breathe. It's an instant call for help. And by the end of this, you're going to know exactly how to answer that call. So, here's our roadmap. First, we'll cover how to even know if someone's choking. Then, we'll get into the difference between mild and severe choking, what to do if they're still conscious, what changes if they become unresponsive, and finally, what happens after you get the airway clear. Okay, part one, what choking looks like. Because before you jump in and do anything, you have to be a detective for a few seconds. What you see right away will tell you everything you need to do next. And I know this sounds super basic, but it's the first rule of any emergency. Before you even reach the person, just take a half second to make sure the scene is safe. Is there anything that could hurt you or them? It's a quick check that can prevent a bad situation from getting worse.
All right, this is probably the most important fork in the road you're going to face. Is this a mild or a severe obstruction? If it's mild, they're still moving some air. They can cough, and it's a strong, forceful cough. They might be wheezing, but they can still make sounds. Now, if it's severe, it's the opposite. Their cough is super weak, or maybe they can't cough at all. They can't speak, can't cry, nothing. You might see them grabbing their neck, and their face might start turning blue. That distinction is absolutely everything.
And listen for a sound called stridor. It's this high-pitched, almost musical squeak when they try to breathe in. If you hear that sound, it's a code red. It means the airway is almost completely blocked. It means you have to act, and you have to act now. Okay, section 2. You've made your assessment. It's serious, but they're still conscious. What you do in these next moments, and just as importantly, what you don't do, is critical. Now, get ready for what might be the most counterintuitive advice I'll give you. If that person is coughing hard, if they have what we call an effective cough, your job is to do absolutely nothing. Don't interfere. Their body's own ability to cough is way more effective than anything you can do. Seriously, that's it. For a mild obstruction, you are their coach. You stay with them, you watch them closely, and you just say, keep coughing, you're doing great, keep coughing. That's your role. No backslaps, no water, just encouragement. But if it's severe, if they can't cough, can't breathe, can't talk, that's your cue. It's time for abdominal thrusts, also known as the Heimlich maneuver. You're going to get right behind them, wrap your arms around their waist, make a fist and find that soft spot just above their belly button but below the breastbone. Grab that fist with your other hand and then give a quick, hard upward thrust. Think in and up. Each one is a separate attempt to force the air out of their lungs and pop that object out. Now, there are a couple of important exceptions. What if the person is pregnant, or if they're large enough that you can't get your arms around their abdomen? Simple. You just move your hands up to the center of their chest, and you do chest thrusts instead. The motion's the same, just a different location. And your goal is simple. You keep doing these thrusts until that object flies out, or until the situation changes for the worse. And this is that moment we all hope never happens. The person goes limp, they've lost consciousness, the situation just went from urgent to critical, and our response has to escalate right along with it. Two things have to happen right away. First, don't just let them drop. Guide them carefully down to the floor, preferably onto a hard surface. And second, if nobody has called for an ambulance yet, that has to happen right now. Yell for someone to call or put your phone on speaker and do it yourself as you work. Okay, and here is a massive, game-changing rule that you need to burn into your brain. For an unresponsive choking victim, you do not check for a pulse. You skip it completely. Why? Because we assume they don't have one or are about to lose it. Wasting even 10 seconds looking for a pulse is time you don't have. Go straight into chest compressions. So what does that look like? It's basically CPR, but with a twist. You're going to get on your knees and you're going to start chest compressions, hard and fast, right in the center of the chest. Give 30 of them. Those compressions can actually work like an abdominal thrust and dislodge the object. After 30 compressions, you tilt their head back, open their mouth, and you look. Only if you see the object should you try to sweep it out. Then you attempt 2 breaths. If the air doesn't go in, who cares? You go right back to 30 compressions. It's a loop. 30 compressions, look for the object, try 2 breaths, repeat. And when you're doing those compressions, you've got to be fast. We're aiming for a rate of 100 to 120 compressions every minute. The easiest way to get that rhythm? Think of the beat of the song staying alive. No, really. Push hard and fast to that beat, right in the center of their chest.
And I have to say this one more time because it is so incredibly important. After you do your compressions and you open their mouth to look, do not, I repeat, do not just stick your finger in there and fish around hoping to find something. That's a blind finger sweep, and you are way more likely to just push the object deeper and make things worse. You only take it out if you can literally see it and grab it easily.
Okay, let's breathe. Let's fast forward to the moment where what you did worked. The object is out, the person is breathing again, the immediate crisis is over. But you're not quite done yet. Now you've got to see where they're at. If they're awake, if they're responsive, just help them get into whatever position feels most comfortable. But if they're still out of it, still unresponsive but breathing, you need to roll them gently onto their side. This is the recovery position, and it's fantastic because it keeps their airway open and prevents them from choking if they vomit. Either way, you stay with them and you keep watching them until the paramedics arrive.
And here's the last non-negotiable step. The Heimlich maneuver is powerful. It has to be, but that means it can sometimes cause bruising or even internal injuries. So anyone who has received abdominal thrusts, even if they feel totally fine, absolutely needs to get checked out by a doctor afterward. So let's just boil this whole thing down to its core. 1. Identify. Is it mild or is it severe? 2. Act. If it's mild, you're a coach. Encourage coughing. If it's severe, you're a rescuer. Abdominal thrusts. 3. Escalate. If they go unresponsive, don't even think about it. Start chest compressions immediately. And 4. Follow up. Always, always, always get them checked out by a doctor.
Look, you have the knowledge now. You know the steps. You know what to do. The biggest barrier in any emergency isn't a lack of knowledge. It's the fear of doing the wrong thing. It's that moment of hesitation. But now you know what to do. So the only question left is, when that moment comes, are you ready to be the person who decides to act?